Welcome everyone to the back chat with the back doctor. Today we have got the second part series onto mental health matters. So there's a lot of different topics that we're going to be going through, and we're going to be going through them together in more detail, which I'm super excited to do because the last one I did this was last year, and then I had a bit of a break where we did different types of different issues and we had different guests on the show. Now, the reason why I saved this second part to the new year is because mental health is a big thing. It's an issue that's been growing over time and it's becoming more and more common. So, I'm going to be breaking this down and we're going to be going through it together in more detail. So, let's do a bit of a recap. Okay, so mental health is a crucial part of overall well being, influencing how we think, how we feel, and act. It affects our ability to handle stress, build relationships, and achieve goals. Challenges like anxiety, depression, stress are common but manageable with, first of all, awareness, self care, and support. Good mental health isn't just the absence of illness, it's a thriving emotionally and socially. By fostering understanding and breaking stigma, we can create a supportive environment where everyone can reach their full potential. Mental health matters to us all. And now I'm going to touch a bit more about the more common things: awareness, self care, and support. Let me do a bit of a breakdown. So, when I talk about awareness, it's really understanding and connecting to your body. It's not about you comparing yourself to other people. Everyone is different. Everyone has a special trait. Everyone has a genius. Everyone is strong at certain things, and some people aren't strong in other things. I think back to my school days, and I have terrible memorization. You put a book in front of me and expect me to remember everything that's written in that book, gone. However, if you got me with my hands and put me hands on, I could remember the person's spine. I can remember who it is, who they are, what stresses they go through just by placing my hand on them, and it just triggers all the memory in my brain. Does that mean that I have an issue? No, it's just that's where my geniuses lie. So we're going to be very careful in trying to compare ourselves to other people. The second thing is self care. Sleep is a big issue. The way we eat, the way we exercise, all of this has a massive impact into your brain. So it's really important that you are looking after yourself with hygiene, nutrition, exercise, getting adjusted, all of the above, getting sleep. And then finally, support. Human beings are social creatures. We are designed to be social. You got your friend next to you, you got your besties, you got people that you connect with. Who are you if you don't have connection? If you don't have those people that you care about and they care about you? How far can you go in life if you don't have people supporting you? Because no one succeeds alone. And when I talk about mental health, it is such a strong pillar that when you have people that you can go to, talk to, just vent, sometimes get feedback, advice, whatever you need, there's people there for you. So you got to have that support network. All right, I've rambled long enough. So let's get into the main topics of today. We're going to continue from part one into part two. We're going to address the next three big things, which is PTSD, post traumatic stress disorder. Second is ADD, which is predominantly inattentive presentations. And then we got predominantly hyperactive impulsive presentation. They're like two different versions of ADHD. So going with post traumatic stress disorder is a mental health condition triggered by experiencing or witnessing a traumatic event. Don't have to feel it. Just visualizing it and seeing it happen can traumatically, you can feel it that way as well. Apologies. ADD is marked by difficulty sustaining attention, forgetfulness, and a tendency to daydream. And impulsive presentations is more excessive energy, restlessness, and impulsive actions. So children may fidget, talk excessively, and have trouble sitting still. A lot more common in children than you do see in adults, but adults do have it as well. And I'll touch base on that later. So let's look at the data. Here we have just a nice chart explaining it all. Over the years, PTSD, ADHD, mental health, have they all gone upwards or have they gotten less and less? What do you think, guys? It's gotten more. And the more it's been increasing is due to a couple factors. One of them is the most common one that I hear is that we've gotten better at diagnosing all these conditions. And while, yes, that is true, compared to 200 years ago, these things weren't noticed, even 100 years ago. However, things are getting more and more common. There's not just a steady increase with our diagnostic tools. Our diagnostic tools have gotten to a point now where we can identify. But what's changed now is it's becoming on a bell curve. It's increasing over time. So all of these, PTSD, ADHD, mental health disorders, ADD, all of it is increasing. Not in a consistent linear line, on a bell curve line. And that's important to remember. Because if that's a reflection of not just things being missed, it's a reflection of our lives being affected by our lifestyle, not genetics that have been around for hundreds of thousands of years. Okay, not our environment, it's our lifestyle. So when we look at PTSD, it's a mental disorder. Okay, the common symptoms that you see is like flashbacks. You can get anxiety, emotional distress, and it actually impacts your daily life. So these symptoms get to a point where they're so excessively large that you can't actually do the things that you need to do throughout the day. That could be with your family, friends, going to work, doing your job. All of this gets affected. Could be your sports. Whereas ADHD, it's more of a neurodevelopmental disorder. Okay, it affects attention, impulse control, activity levels. It varies from person to person, but the big thing is it impacts daily functioning. So it's a condition that's being managed a lot better, but you need to remember that it's not something that stops people. It just needs to be, the person needs to be aware of who they are, what they're doing, and as a result they can function at a higher capacity, focus on their strengths rather than focusing on just on their weaknesses as well. So going into PTSD in more detail, okay, the first thing you got to do is know what triggers it. What really triggers PTSD? And the good news is that there is a trigger for everyone. However, the triggers are not the same. Every individual is different. Every individual has special characteristics from what they've experienced, what they've felt, what they've seen. So let's start with the most common things are like flashbacks, nightmares, emotional numbness is a big one, hypervigilance. Triggers range from sensory cues to situations that remind individuals of traumatic events significantly affecting their daily life. The main one I'm going to touch on is emotional numbness. Right now, we have these mobile phones, and we've got these reels that just slide constantly with different 1 minute clips, 30-second clips that take us away from our concentration. So we already become at a higher level of cortisol, a higher level of dopamine, which is our happy hormone. So our body becomes less tolerant. It becomes more tolerant to that high level. So experiencing everything in life becomes more like an emotional numbness. So people can get misdiagnosed. People don't even get diagnosed because of the lifestyle factor affecting this. People could be emotionally numb, but they could be acting completely normal, and that's because of mobile phones. So how does it affect people, right? It affects people's well-being. I touched on it just earlier, but it leads to other mental health issues: anxiety, depression, isolation. Okay, it manifests in sleep disturbances, chronic pain, heightened stress responses. And the importance of this is there's many different ways to manage it. Okay, generally it's more cognitive behavioral therapy. They call it EMDR, support systems, and sometimes medication. Now, my general rule of thumb is medication is a last resort if there's no other solution, if someone's suicidal, okay? Because medication numbs the problem, it does not fix the problem. And when you're dealing with complex issues like PTSD, you need to be able to address the real cause. What's the trigger? Why is it happening? And you have to get the person to connect with their body. If someone's emotionally numb, medicating them is not going to fix it. It's only going to make it worse. Let's move on. Let's go to ADD. So this again is like what we mentioned earlier, maintaining focus, forgetfulness, frequent daydreaming. They they lack hyperactive behavior, so it's a lot more difficult to realize. So this is more someone like, they space out, they don't focus as well. It's very uncharacteristic. It's very less focused than someone else can be. It's hard to see because normally if someone's super hyperactive, everyone's looking at them going, "Whoa, what the hell's going on here?" Whereas if someone's very chill and relaxed, you're thinking, "Oh, it's a very calm person." But that might not be the case. So there are ways to actually measure this, but you need to measure it, and that's academic performances. Do they actually put the energy in? Is it just they're lazy? No. Do they actually put the energy into learn? Are they able to learn? Is a big thing. Right? Are they able to pick up things? Their level of productivity. It can get missed during childhood into adulthood. If you do things like KPIs, which are key performance indicators, are you able to keep up with your key performance indicators? Are you able to hit your targets? And how are you socially? Are you always flat, even with the bestest of friends? Are you always more quiet? Do you space out when someone's telling you a story and you don't have a million other things in your mind? You just go, wow, I can't focus. These are ADD type symptoms. Now, strategies for this, again, is behavioral therapies, right? Training the mind, training the body, connecting with your body. I will repeat this again for every mental health condition. The key factor for a lot of these is connecting with your body, okay? Finding out where your brain is at and fixing the nervous system, okay? It is a nervous system, it's a nerve, it's a brain issue. It needs to be trained. Your body needs to be taught. Like I said, medications are usually last resort, but they are not the solution. They're just a temporary fix. Then we've got the hyperactive side. So we had the hypoactive. Now we've got the hyperactive side. These are people that are quick, fast, impulsive. I'm going to give you a great example. So, for example, the other day I was talking to my friend and I couldn't figure out what the hell is going on. And I was just like, goodness gracious, hold up, a good friend of mine. Yeah, what was his name again? I'm just trying to think of his name. Goodness, I know his name. I know his name. I know his name. Goodness gracious. I think it was John. John, yeah, I think it was John. Someone that sticks to one thing. Like, for example, if I don't remember the name, oh, let me go back to that. Oh, I can't think of his name again. And that already disrupts the whole flow of the conversation because I get stuck on one thing. So you'll find that this is someone that constantly interrupts conversations, that doesn't actively listen. They even interrupt activities. They can't focus. They're very impulsive. I might be fidgeting with this, for example, or I might be fidgeting with my hands constantly rather than a normal pace. Similar to this, it can be managed. Awareness is a big one for this. When someone's starting to notice that they're being hyperactive, they can calm themselves down. They can actively calm themselves down. And that's powerful because you train the mind to catch when you're going off the track and bring yourself back into a centered position. And that's important. Now, someone that's going into a higher level of energy doesn't necessarily mean they have ADHD. There's a spectrum here. And a spectrum, you can go from one end completely, or you can be sitting on a higher energy spectrum, a lower energy spectrum. Everyone's different. What you need to look at is how well the person connects with their body, and does it actually start to affect their life? Is it hindering their life? And if that's the case, you can manage it and you can fix it. So there's certain areas that you can go to. This is in the Wollongong area. There's the Shell Harbour Clinic, there's the Headspace Wollongong, there's Niemi, and there's Illawarra Clubhouse. These are four great places that I've had a chance to connect with, and these are people that are focused on getting you healthy and well, not having medications as the first option. I'll touch on this a few more times before we move on, and that's your body is powerful. Your body has this innate potential to improve to an amazing level. And I want you to remember that if you feed your body the right things, your body will always do its very best. And the last thing I want to add to that is your nervous system, your spine, your posture. How well do you look after your spine? And if you're getting adjusted, you're maintaining that nervous system, you're maintaining that integral part of the body. Because if that gets affected, it affects everything else in your body. It affects how well your body digests food. It affects how well your body produces energy, how well the body communicates with the brain. A really great example I like to give with chiropractic care, and especially with kids and adults that do have these mental health disorders, their stress decreases. And you might be saying, how the hell does stress decrease? A couple ways. The first one is if you're in physical pain, you're under stress, you're in pain. And when you get adjusted and the pain decreases over time, your stress goes down. Your body functions better. Your brain can use its resources to heal you better. The second way, so we talked about physical. Now we're talking about the emotional stresses. There is a specific nerve in your body called the vagus nerve. And the vagus nerve is part of your parasympathetic nervous system. And that's where your body heals. It rests, it digests. And that's a key factor in making sure that your mind is at its best position as well. So when you get adjusted, we influence that vagus nerve, which travels from the top of your spinal cord all the way down. And that improves people's disorders too, just by decreasing stress. And the third way is the chemical. If your organs are overworking, if you're constantly drinking alcohol, if you're having drugs, if you're having medications, there's so many side effects involved in it. Now we're adding all the lifestyle things as well. So sugars, right? Lollies, processed foods like McDonald's, KFC, or Portos. Um, let me go. Let's keep going. Mad Max, right? Heaps of places. Chocolate. All these things have all these sugar and processed foods that unfortunately affect the chemical aspect of our body. And now you might be saying, how does chiropractic help that? And I'll simply say, vagus nerve. The vagus nerve is what calms the body down, heals the body. So while all your organs are working overtime because of all these processed and unnatural foods, getting adjusted, helping the vagus nerve, allows your organs to heal, repair. But if you're having foods all the time, sugary foods, non-healthy foods, that's not going to fix you, even with adjustments. So I'll leave you with this. Do these four main things in your lifestyle. The first one is break bad habits. Be aware of what you're doing. The second is exercise. Get movement in your body. The third is drink plenty of water. We don't drink enough water anymore, and that's becoming a big problem. And the fourth is get your spine and nervous system checked, get it adjusted. Because there's no harm, there's only benefits doing all four together. So if there's any questions, please let us know and we'll look after you. And I wanted to say thank you to everyone listening to this podcast episode because it is a topic very close to my heart. And if you want to know anything in more detail, I'm happy to go through that with you. This is Dr. Oz from the Back Chat with the Back Doctor, signing off. Take care.